That's sort of how the routine works. Now, he is in his 12th year as chairman and CEO of CADCA. His responsibilities include providing strategic direction, diversifying and increasing funding, leading the board, being the primary spokesman for the organization, and overseeing the operations and the personnel of CADCA. Now, before joining CADCA, though, he spent some 31 years in the U.S. Army, retiring at the grade of Major General. General Dean retired from the Army and then joined CADCA the next day. How's that for commitment? And he has worked every day since to make this organization a great one. So please, would you help me in welcoming to the stage General Arthur T. Dean.
Well, good evening to all of you. What a task following Leon Harris. Thank you so much for coming back, for being a part of this, and for your leadership and support. We appreciate it very much. Thank you. As you have heard, we are here tonight because we believe that kids in this country deserve to grow up in safe, healthy, and drug-free communities. We're here to celebrate the work of our community coalitions, and we're so proud that so many of them could join us tonight, and the people who support them and honor them with their services. We are excited about that. Our columnist, Gloria Borger, said, "For most folks, no news is good news. For the press, good news is not news." Okay, so I do have some very good news to share, and it's here, and it's important that I do that, but our friends from the press would probably say good news is not worthy of presenting. So some of our partners from the White House Office of National Drug Control Policy are here with us tonight. They have been great supporters of our work and provided wonderful national leadership. And I need to report to you that according to their evaluation of drug-free communities programs, that is coalitions in communities out across America, that the program that we at CADCA helped bring to light and to encourage Congress to pass and have been working every year to support that program, that substance use rates in communities where coalitions exist are much lower than communities without them. In communities with active coalitions, past 30-day use of alcohol, tobacco, and marijuana declined significantly and in all grade levels. Youth in communities with coalitions believe drugs are more dangerous, and as a result, they are less likely to get involved. It is estimated, and I want you to hear me out on this, it is estimated that because of coalitions, and this is the data that we received, there are some 181,000 fewer youth using alcohol, 200,000 fewer youth using tobacco, and nearly 115,000 fewer youth using marijuana. So we are excited about that outstanding result. Also, ONDCP has stated that the administration's national drug control strategy rests on the building drug-free prevention coalitions, and that is a pretty powerful confidence for them to have in our great work. We are going to need those effective coalitions now more than ever. And why do I say that? Because I must now turn to the bad news. And the bad news just came out this week at a press conference held by the Office of National Drug Control Policy and the Substance Abuse and Mental Health Services Administration, that after years of decline, drug use is on the rise. New data from the National Survey on Drug Use and Health, just released last week, shows a 9% increase in overall drug use. That means that almost 22 million Americans used an illicit drug last year compared to 20 million in 2008. Just in 1 year, overall drug use by youth aged 12 to 17 increased by 7.5%. Marijuana use increased by 9%. Prescription drug abuse increased by an astounding 17%. Ecstasy and meth use is also up. So a great concern is that the survey also showed that youth attitudes are softened about drugs. We know that research says that if young people do not perceive drugs to be dangerous or harmful, then their use increase. The bad news last week prompted this question. Why? Well, for starters, the Drug-Free Communities Program funds coalitions in 741 American communities. And we think we are very proud to have more than 741 of our coalitions receiving federal funds. But according to the U.S. Census data, there are over 19,000 incorporated places or communities and towns in America. So that tells you that there are plenty of places in these United States that are without a community coalition, and we need to be about trying to resolve that. Some have pointed to the economy. Some have pointed to the rise in the so-called medical marijuana as sending a mixed message to kids. Less time and funds for school-based prevention programs. And finally, they are all just too distracted because there are too many other things going on in this great country. Well, we need to put our BlackBerries down. We need to pay attention because whatever the factors are, we have to act now. Now is the time to redouble our efforts. We don't want to waste the progress that we have achieved over the last few years in reducing substance abuse. We cannot afford it for our nation nor for our young people. The people in this room are the ones who can really make a difference. And there are many, many more out there like you across these lands. We have a national coalition of key people right here in this room who can help us turn this around. What is required first and foremost is a major investment. And that investment needs to be in upstream prevention, combined with an emphasis on early intervention in case they are not prevented from getting involved. Then we need to find the very best treatment available, and we know that there are far too many people in need of treatment than are receiving treatment. And we have to have a strong law enforcement arm as well. And then when we get them through treatment, we have to have great strategies to keep them on the road to recovery because we know that treatment, in fact, does work. So since 1944, CADCA and our advocates have been at work with the support of many of you, restoring cuts to ensure that funds are available. And since 1994, our records indicate that we have been able to restore or increase funding to the amount of $2.66 billion. Since 2002, CADCA has trained nearly 46,000 people at 800 individual different trainings across this country. Through our National Coalition Institute, funded by Congress and delivered in partnership by the Office of National Drug Control Policy and SAMHSA, we have been at work training people, as you can imagine. We just launched a new toolkit, and our toolkit is designed to help communities from start to finish to address RX abuse. That is prescription medicine abuse, and you saw it just increased by 17% last year. With support from the U.S. Department of State, we are also working internationally to do the same work. We're currently in 8 countries, and we have built to date more than 50 international coalitions to address this work across Central, South America, and now on the continent of Africa. We've trained more than 500 young leaders just this year alone. Events like this help us to expand that mission, and we are so excited that you have helped us to do that. We do our part, and you all do yours, and we thank you for that. We thank you so much for the donors that are here tonight, for the sponsors, and for making this evening possible and highlighting the important work that we all have ahead of us. So I want to close with this quote, and I never thought that I would be quoting Napoleon. But I'm going to do that tonight because this quote I think is appropriate for what we are talking about. But this one is really, really one that works, I think. And he said this: "Never awake me when you have good news to announce, because with good news, nothing presses. But when you have bad news, arouse me immediately, for there is not an instant to be lost." My friends, our nation's future hangs in the balance. We must see these increases as a wake-up call. Our youth deserve nothing less. And I ask you for your commitment and your renewed commitment so we can combat what is happening in our nation. Thank you for being here, and God bless you.
My man. All right.
Thank you very much.
All right.